Hi everyone, this is Professor Hoffman. I am coming to you through your screen to do a little bit, a kind of a quick, I don't want to say tutorial, but a quick rundown of how to conduct a suicide assessment if you encounter a situation where a student is in crisis and you need to evaluate to see if an intervention needs to be taken place and how to keep everyone safe. This is just meant to give you information and some tools on how to do that. There is no expectation that you would be a professional clinician within your role. You do not need to do these on your own. Always make sure you have any support. More or less, it's just to kind of introduce you to how assessments are done, give you some awareness on how to interact with a student who might be in crisis. It's just meant to keep you safe with the assessment, keep the student safe in crisis, and just have some level of empowerment within your role. So I am going to kind of walk you through very briefly. This is not meant to be a very comprehensive training. This is just kind of a supplement to the training that I will be doing in person, but it's just a good reference and resource if you need to refer back to it. So I'll be walking you through SAMHSA, which is the Substance Abuse and Mental Health Department. It's part of the Department of Health. They've put together a 5-step assessment process. I've modified it a little bit because it is really tailored to like the clinical environment. So I've changed it a little bit to be a little bit more practical for a student success coach environment. Again, it's just meant to be a tool to help you, empower you in your interactions with students. So to start off, I just wanted to kind of briefly reflect on why it's important to be able to have some knowledge around suicide assessments. The current stats I pulled from 2020, there wasn't really anything much more current. It's indicating that it's the 12th leading cause of death in the United States. Just over 45,000 Americans died by suicide in 2020. It's estimated that there is over 1 million attempts in just 2020. And that of the suicide deaths, over 50% were attributed to firearms. I can see that I wrote a typo in this PowerPoint, but we're just going to roll with it. Firearms is spelled wrong. Anyways, these are from 2020 in the midst of the pandemic. I would hypothesize that these numbers have probably increased slightly since there's a lot of residual mental health issues going on post-COVID and kind of the aftermath of that. So as you can see, it's a pretty significant issue and something that is preventable. And so that's where your role comes in. I do want to preface, I do talk about suicide, obviously, in this training. So I know that there's a trigger warning thing, so just be aware that that is going to be talked very candidly. So just be aware if this is going to trigger anything within you personally, just to be aware and make sure you're engaging in self-care. All right, so in your role, obviously you have to engage with students and they're going to trust you. You're creating those safe spaces, those brave spaces. And so there might be a situation where someone comes to you discussing some sort of suicidal thoughts, some self-harming thoughts, or just very depressed things that cause a red flag in whatever the conversation is. And so if this is to happen, here's some places just where to start. You always want to listen to the story and let them know let them know you care. So that kind of goes along with the concept we talked about with safe space and brave space. And honestly, sometimes just vocalizing that there's something going on kind of relieves that pressure a little bit. I always think of an inner tube, you're building. And then if you just let a little bit of air out, you're kind of like, ooh. And not that that's necessarily going to fix or take away anything or the thoughts of wanting to harm themselves. However, it might relieve the crisis and the intensity of it enough to get them to long-term care. So just giving a safe space for them to talk about their story and how they're feeling is really the posture you want to take. And also thanking them that they trust you enough to story, that you may be the first person they've ever told about this. There's a lot of shame associated with these thoughts at times. And so the fact that they're feeling safe enough to be able to vocalize it is something that you want to acknowledge. A very important thing that I had to learn in my clinical practice is there's a difference between having suicidal ideation and having suicidal intent. And so a lot of times, like when I was doing therapy and talking with individuals who might be going through a difficult time, they might throw out there like they just want to die, or they just didn't know if they could go on anymore. And those ideations of ending things aren't necessarily an indicator that they're going to do anything. And sometimes it is kind of normal in situations where there's high levels of depression or high levels of anxiety and feeling kind of stuck. Because for better or for obviously worse, attempting suicide or completing suicide is an option to escape a situation. It's one that we want to avoid. But when people talk about having these thoughts, it's not necessarily meaning they're going to do it. On the flip side, the suicidal intent is when someone's talking very specifically, but they have a plan, they have a method. When we get to the assessment part, you'll see a lot of the red flags. Like you have a sense that this is a plan in motion. You kind of want to flesh out the balance between those two. So just because someone says, I feel like dying, it doesn't mean they need to be hospitalized or an immediate intervention needs to be placed. You take it very seriously, but your response to ideation versus intent will be a little bit different. Another thing that I had to learn early on, I was kind of afraid to ask about suicide. It felt uncomfortable. It felt like, oh, if I say that, are they going to then think they want to do it? There is so much research to show that if you ask directly about suicide, asking about a plan, confronting it head on, does not trigger a person to actually follow through or plant the seed in their head. So what you want to do in order to get a clear assessment is just asking straight on. And sometimes it takes the pressure off a person who's feeling these feelings and thoughts to just have somebody else say it and speak it into existence. It shows them that you care and that you're willing to go to the tough places. So that is something you want to keep in mind, is asking directly about it is actually far more beneficial than skirting around the issue. A, because you're going to get a better assessment, and B, it's not going to prompt them to do any sort of action that they hadn't already thought about. You want to show understanding and take their concerns seriously. Although what they're experiencing or their specific situation may not seem that intense or that severe or that big of a deal to the assessor, it's the current reality of the individual. For example, when I was doing my clinical work, I had a client who was very upset that she was not getting a snack at her adult foster care home, and to the point where she was expressing she wanted to harm herself. Now, in my head, I was like, are you kidding me? Like, it's a snack. But the current reality of this client was, I'm not getting what I want. I feel trapped. I'm so upset that people are controlling my life. I want to hurt myself and get out of this situation. And so me laughing at her or being like, are you kidding me? What the heck? Would not have helped the situation. So validating the feelings that they're feeling. Don't necessarily validate that that's a reason to contemplate suicide is not getting a snack. But you can validate that, hey, it sounds like what you're going through is really difficult for you. And so taking all concerns seriously and validating the feelings is a very powerful tool within assessment. And the last point kind of piggybacks on that a little bit, is that you want to avoid debating the value of life, their decision, what they're thinking, or trying to give advice in the situation. That's not your role. Your role is to get them to be in a safe place, not to try to fix the problem. That's for whether they go to third chair or different outside resource. That's where they work on the advice giving and exploring all of the reasons for why they're feeling the way. Your role is just to get them to establish a sense of safety, whether that's through hospitalization intervention or a safety plan through the night to get them to somewhere safe the next day. So just keep that in mind. A few warning signs to look out for if you are noticing that a student is exhibiting any of these warning signs. That would be a time to kind of conduct assessment. So hearing a lot of language about wanting to die or to kill themselves. Obviously, as mentioned in that the statistics slide, guns are a very lethal methodology of suicide. And so if you're observing that people are looking to buy a gun, or there's a lot of language around guns, that's a pretty big warning sign that you want to take seriously. If they're expressing a lot of hopelessness, no reason to live, kind of that like very heavy, I don't want to say Debbie Downer because that's not quite the right description, but having a lot of like negative self-talk, negative talk about life, or they're not super future focused. They're very down on a lot of things. So that feeling trapped, having unbearable pain, being a burden to others, those are all signs that maybe something more serious is going on. Increasing the use of alcohol and drugs. So obviously Kuiper's a dry campus. There might not be the presence on campus, but if you know that they're going off campus and utilizing alcohol, drugs, what can happen with that is obviously alcohol and drugs can impair judgment. And so while people are under the influence, sometimes that can lead to making decisions they might not make while they're sober. Sometimes, obviously, alcohol and drugs, part of the appeal of them is it numbs out feelings and pain. And so it might temporarily fix what they're feeling, but once the high or intoxication wears off, that can trigger then feelings of guilt and shame that they've just done something that they don't necessarily want to do, and then that can kind of snowball into feeling worse, so wanting to use more to avoid the uncomfortable feelings. And so increasing the use of that might be a sign that something is going on. Anxiety, agitation, so something that's off of their baseline behaviors, like if someone's usually pretty easygoing but they're getting really agitated, that's kind of a sign that something's going on. Sleeping too little or too much, I think often sleeping too little is associated with depression, but sleeping too much is associated with depression, but sleeping too little can also be a sign because of a racing mind and not being able to relax. Withdrawing or isolating can be a little bit hard in dorm life, but if you're noticing that someone's not coming out of their room as much, leaving campus, kind of not engaging in coming down to the dining hall or on-campus activities, not coming to chapel, that might be a sign you want to check in on somebody. Showing rage or talking about seeking revenge. So anger is often, we consider anger a secondary emotion, and so sometimes when someone's showing anger or rage, it's masking and mirroring a deeper emotion, usually sadness or depression, and so anger can be a sign that there's something deeper going on that needs to be addressed. Again, not with you, but with a professional in a counseling setting. And then that kind of tacks onto the extreme mood swings. This is not a comprehensive list, but this is just a list that's been put together by the Suicide Prevention Lifeline as things for individuals, not necessarily clinicians. So anybody can look for as signs about that there might be suicidal thoughts in people around you. So I am going to stop here because I only have 15 minutes on this recording website. And so I'm going to do a part 2 where I go through the 5 steps of assessment. They're adapted from, like I said, SAMHSA's safety tool. So this is targeted towards a clinical setting, but in part 2, we'll go through them and you kind of see how they are adapted to be a bit more user-friendly for just the general population. Stay tuned.